Good evening. My name is Melissa Davis, and as co-chair of the annual appeal dinner, it would have been my great pleasure to welcome you to our annual dinner tonight at Leonda, celebrating all that makes Jewish care so special. Instead, however, it is with a heavy heart that we are reaching out to you online, as our annual appeal has become a crisis appeal with a new target of $5 million. Now more than ever, Jewish Care urgently needs your support, as we ask you to consider the vulnerable in our community who desperately need our help at this difficult time. This global health crisis, a nightmare into which we have all been plunged, is placing an enormous strain on Jewish Care's resources. Now, in addition to the vital services that Jewish Care already provides, we have the COVID-19 helpline, established to assist and support those impacted in the Victorian Jewish community by the coronavirus. Tonight you will hear an important message about our COVID-19 helpline from Marilyn Kraner, Manager of Individual and Family Services. She will be followed by Professor Sharon Goldfeld, a Director on the board at Jewish Care. Sharon is a developmental paediatrician and public health physician, co-group leader of policy and equity at the Murdoch Children's Research Institute, and director of the Centre for Community Child Health at the Royal Children's Hospital. We will conclude tonight with an exclusive premiere screening of episode 1 of our wonderful new video series. We all need some light relief in our day at the moment, so make sure you stay watching to enjoy the wisdom and humour of a group of elders from Garry's Morgan House, the stars of our brand new series titled If I Could. Thank you for joining our crisis appeal online. Hopefully next year we will have our annual appeal dinner once again, in happier and healthier times. May you all stay safe and strong. Good night.
Hi, I'm Marilyn Kraner and I'm the Manager of Individual and Family Services. And in this area we look after all the vulnerable people in our community through a range of programs that we run. But today I'm here with the helpline. These are the staff behind me who are the social workers and others who are answering calls from the community who are impacted by the COVID-19. We get lots of calls all week about a whole range of things, but since the helpline we've been really focused on trying to make sure that we support people financially, emotionally, that we support them along with some of their practical needs and with as much information as we can provide. I'm really pleased that the Erdi Foundation and Spotlight Foundation were able to support the development of our helpline, and if you're in a position to help us now, we would be extremely grateful for any support that you provide. So thank you so much for listening to this video and for contributing to improving the lives of our community. Thank you.
Thanks very much, Melissa. I'm very honoured to be one of the directors of the board of Jewish Care. But what many of you may not know is that I'm also a paediatrician and a public health physician, which, as it turns out, are the two aspects of what's unfolding here in Australia with the COVID-19 pandemic. On the one hand, we have the crisis emerging around the virus itself. And as we know, that virus disproportionately affects those more vulnerable in our society, and in particular, the elderly. But the other crisis that's emerging is as a result of the social interventions which we just have had to have. But of course, the impact on families and on children will be going on well beyond the viral impacts in what we've called the long tail of the age of corona. And I'm talking to you about these two aspects because they're so fundamental to what we do at Jewish Care. On the one hand, we're absolutely having to protect our elderly, both through our residential care and our in-home supports. On the other hand, we've set up a COVID hotline from March the 23rd, and we have been inundated with phone calls. People have been losing their jobs. People who haven't had mental health problems are now having mental health problems. Families are wondering how they're going to balance getting their kids educated being able to actually work themselves, working out if they even have enough money to do the sorts of things they've always wanted to do as they slowly lose their nest eggs. The amount of anxiety in our society is really going quite high. And as part of that, Jewish Care has been there to accept financial counselling, other sorts of counselling, mental health problems, family violence, and also supporting those that most need it amongst our elderly and those with a disability. This has meant a large surge in the capacity of Jewish Care to deliver on these sorts of services, and I'm sure you all realise how very important they are for our Jewish community. And I ask you, I guess, in any year that you've ever donated, this is really the year to give to Jewish Care as we try and increase our services to ensure that we can really, truly meet the needs of our Jewish population. So moving on from here, I want to just move on to a slightly lighter note and leave you with a little video called If I Could, which is a few messages from our elders at Gary's Morgan House. Thank you.
What a trap. What a trap.
I give up.
I think from the neck down.
At least I'd still have mine.
If you have your wits about you, you can try and do something about it.
The majority of ladies would choose ageing from the down.
Well, I'd hate to lose my mental ability.
If I'm still got my marbles, I would still enjoy life.
If you can have this that's not aging, you can do a lot of other things.
We like to keep our faces.
You mean if you are a sandwich at a picnic?
Good looking and stupid.
I could not give up being clever.
I thought it'd be ugly and smart.
You can be with the ugliest looking person and find equality there. I think I might choose ugly. Because you could always improve that.
Ugly and smart. Because I'd like to be smart.
I would hate to be stupid.
If you got up there smart, your words will be able to change the appearance shake.
It doesn't depend on how broad your shoulders are or how beautiful your eyes are.
I wouldn't like to be ugly either. It's a bit of a dilemma.
No.
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 No, I wouldn't like to live forever.
When you get too old, you've had it.
Forever is a long time.
I'd be bored stiff, I think, after the first 200 years.
We have our time. The time is up, one should go. Gracefully.
The young ones should take over, let the old ones go.
The age I am now, 92.
30s was probably the most interesting and happy period of any part of my life.
Late 20s or early 30s. I think that would be a good age to live again.
Each age has its wonderful times, and each age has its unpleasant times. I've been through the bad and I've been through the good.
Happy marriage, 2 children.
I was very happily married, and with the children that I would like that.
I've been sad, but I've also been happy. You've just got to take it as it comes.
I enjoyed life. And I was still young enough to do what I wanted to do. Now I'm an old takaka, and a lot of the things that I used to love doing, I can no longer do.
healthy?
Oh, healthy.
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 Health.
I think I'd be healthy.
Healthy every minute.
Money can't give you everything.
If you're healthy, you can do anything. If you're rich, you're stuck.
If you're healthy, you can have fun and you can live.
You can't eat the money and you can't buy health with.
Oh, darling, being rich is nothing.
Money can spoil people.
God forbid one was not healthy. There's not a great deal you can do about it.
To be rich would be nice, but health is gesund is more important.
If you have health, you can do anything.
Money is almost like a god, but health is something you can't buy.
Being rich is just money to buy things that you don't even need.
With someone I don't like. I don't like to be on my own. That's why I came here.
By myself, I wouldn't like it.
To be alone. If I was with somebody that I couldn't stand, I'd finish up in a fight.
If you have somebody you don't like, at least you can have an argument with them.
It's always better to have somebody, but then to be alone is not the end of the world. With someone I didn't like.
With someone I don't like, because you can slowly make friends.
I am not, how you say, only the Germans, which I can't get off from my heart.
In time, we'll be able to get on.
After a while, you can always need other people, and you could get to like them or get to know them and why they like that.
People need people.